What is a take charge mindset, and why do you need one? If you want to know how a take charge mindset can help you achieve lasting health, stay tuned. Hello, I'm Dr. Raymond Edison, MD, admitting you to this channel where we show you how to take charge of your health. This is the first in a series of videos that accompany my book called Take Charge: How to Achieve Lasting Health. In this series, we will expand in some ways on topics in the book and add additional information, all in an effort to show you, the motivated person, that you can take charge of your health and delete chronic diseases in your life. Now, I realize in our present healthcare system, you're often spoon-fed information and directed point by point on what to do. This is not what we're doing here. Here, we are showing you how you can take charge of your health. And you don't have to know as much as I know about health to take charge of your own health, and how you can use that information to further your health in preventing chronic diseases. This is for you if you're that 1 to 2% of people who have that mindset to take charge and take the bull by the horn, so to speak. If you're not that type of person, this may not be that useful for you. We sincerely do hope you enjoy these series of videos that accompany the book. Now, this is what you'll learn in this video. How does a take charge mindset lead to a successful outcome? The difference between mindset and wishful thinking, and the number one important factor needed to be healthy. What we're talking about here is freedom from chronic diseases. Diseases like obesity, diabetes, metabolic syndrome, autoimmune diseases, hormonal disorders, gut problems, and stress. These are just some of the factors that come together to keep you in that chronic disease state, rob you of your happiness and well-being. Now, you see, statistics show that 75% of all annual deaths come from chronic diseases. Yet, we don't emphasize chronic diseases enough in our society, because the best treatment for chronic diseases is preventative. And our system is designed to, if you're hurt, go do this. If you sneeze, do that. If you have pain, if you cough, do this. It's designed for when symptoms occur, not much emphasis on preventive. And we do a good job in acute care. You fall down, break a leg, you get shot or stabbed, your appendix goes bad. Those things are set up like clockwork, and you can recover from those things quickly because they require quick action. But chronic diseases are a little different. They're put on the back burner because they don't show up in the way acute diseases do. They may be weeks, months, years before you get any symptoms from chronic diseases, and then all of a sudden, you have problems. You see, chronic diseases are like ninjas. When you let your guard down, they come in. And you let your guard down by eating processed food, sitting around all day, not getting enough rest, letting life stress you out. And that allows those silent, subtle problems to jump out. And the next thing you know, That bad action has sprung on you and caught you by surprise. And now you're in the land of difficulty. Doesn't have to be that way. And if you are there, there's a way you can get out. So a take charge mindset involves the following. First, you make a decision to be healthy. You don't just accept the fact that you are healthy and that you're going to be healthy if you are healthy. You make a decision to be healthy wherever you are. Then you educate yourself about healthy living. Things like this book and video series, there are plenty of places where you can gather information on how to be healthy, on what we think is good for us is not, things like that. You have to get hold of that information. Then, thirdly, you have to take action to bring about that change. So it comes down to deciding, knowing, and doing. You need all three. One won't do. You can decide, make a decision. I'm going to get healthy next week, next month, next year. You can read my book, everybody else's book, watch all the videos and say, oh, I know what to do now. I know not to do this. I know to do that. And just sit there, nothing's going to happen. Then you have to take action. Now, if you take action without knowing and making a decision, it'll just be random action. Oh, maybe this is good for you. Maybe that's good for you. Oh, I'm going to do 10 jumping jacks today. Oh, I'm going to try to lift 300 pounds tomorrow. Action misdirected doesn't help you. It's got to be purposeful action. You got to decide that you want to be healthy. You've got to get the knowledge you need to be healthy. And then you have to take purposeful action to accomplish that. That is the take charge mindset. That is what, if you have, you're going to love this. If you don't have, you should listen so you can get it. So it comes down to, what have you decided? What have you learned? And most importantly, what have you done? So you see where I'm going with this. If you already have this way of thinking, then I'm singing to the choir. But if you're on the fence, if you're saying, I'm short in one area, then you ought to stay tuned. Because hopefully the purpose of this whole thing is to help you get there. Because here's what you're dealing with, folks. You're dealing with chronic disease taking us out more than anything else. You're dealing with a physician and nursing shortage, which means that the ones that are out here don't have time, the time that you need to learn a lot of things. That's why your digital doctor popped up, to help you bridge that knowledge gap, that information gap that the acute care model just doesn't have time to give you. They're under tremendous pressure to move quickly, to see patients, just to survive. And what I'm talking about with this take charge mindset, it's not anything that's foreign or anything that you haven't done. You learned how to walk, you learned how to talk, you learned how to run, jump, all without any formal education. Just watching everybody else around you doing it and you wanting to do it, and lo and behold, there you are. And how did you learn these things without a formal education? You watched what was going on and you got into repetitive action. You failed a lot of times before you walked. That didn't stop you because you wanted to walk. You mixed up words and pronounced them wrong, and even to the point that people were laughing at you. But you kept trying until you got it right. And that's the attitude you have to have. Repetitive action can lead to mastery. Do you think the sports stars dribble the basketball just once and all of a sudden can run up and down the floor doing it and took just a couple of shots and now they can hit three-pointers at will? Or the baseball player can look at a pitch coming at him close to 100 miles an hour, time it right, and knock it out of the park. You can have a natural propensity to that and those things, but you don't learn those skills. You develop those skills. You got to hit 1,000 balls to be able to get in a pressure situation and knock it out of the park. And the thing you have to look at is that you don't let failure stop you. You let failure motivate you. If you try some of the principles that I'm going to talk about in the upcoming videos and it doesn't work, and you just have to try them again. You have to be determined. And if you don't think I'm the right guy to tell you, you got to find somebody else. And that's honest, because most people will tell you, I'm the only guy that could tell you how to do this. So I just wanted to motivate you in this video of the things that you need to do, the mindset you need to have, the mindset that you've had just growing up in life, at a time when your brain was way less sophisticated than it is now. And you understand that life is about continuing to grow. You may be a full-grown adult at the height that you're going to remain at, but you still can develop your mind. You're supposed to. You should know more in 10 years than you know now. Doesn't matter if you graduated from high school or college or medical school for that point. You need to keep growing, keep learning, and that's how you accomplish the things that you need to accomplish to remain healthy. So you can be looking forward to more videos on these various topics that have to do with health as time goes on. Feel free to get a copy of the book, which can serve as a guide or a reference to accompany some of the information and get in the habit of taking charge, doing things for yourself, not waiting until symptoms appear before you get a good handle on where you are in your health journey. So you can be around a long time and have a good time. Doesn't help being around a long time if you spend your last 10, 15 years in a nursing home totally dependent. You want to avoid the things that put people there. So that's just the introduction of what we'll be about on this channel. And once again, take advantage of the book. The information about how to get it is on the screen here and will be in the first comment. And don't forget to like and subscribe if you feel inclined to do. And we'll be around. We'll see you in the next video. This is Dr. Raymond Edison, your digital doctor, signing off. And for now, you're discharged.